In this video, I'm going to explain what's the bone cancer and what's all the possible methods to diagnose bone cancer. Bone cancer is a real malignant tumor that forms in the cell of the bone, originating from the primitive mesenchymal cells, mostly affect the long bones in the leg, arm, or pelvis. Various bone cancer are named based on their histologic origin. For example, the chondrosarcoma arises from the cartilage, and osteosarcoma from the bone itself, and the Ewing's sarcoma is from unknown histologic origin. There are many different methods to diagnose the bone cancer. For example, it can be used as CT scan, MRI, and PET scan, and X-ray. Second one is a blood test. It's not preferred and but can be used as a tool to detect the bone cancer. And third one is tissue biopsy. This is a procedure by taking a sample from the bone, from the outer layer of the bone. So that's all for my part. I will pass it to my friend Moon. Thank you.
Okay, I'm Muntadar and I'm going to talk about imaging modalities that are used to diagnose bone cancer. For bone cancer, there are several modalities that are used, such as MRI, CT scan, and bone cancer. But for this presentation, we are going to focus on MRI, which is considered one of the most used methods for bone cancer diagnosing. It's also an effective way of assessing the size and the spread of the cancer in or around the bone. So for this presentation, we are going to focus specifically on the technique of T1WSE and FAST-SE images, which are still the most common sequence for imaging bone, with the bone marrow, and the most effective technique. Next, why MRI? So MRI, and why especially T1WSE or FAST-SE? To create detailed image of the internal diagnosed part. It can show the marrow inside bone and the soft tissue around the tumor, including the surrounding blood vessels and the nerves, which helps to establish the exact extent of the tumor for planning the surgery in the future. It can also identify the minor bone cancer that are few inches distant from the major tumor. That's all for my part. Now my roommate will continue.
Hi, my name is Rafifa. I will focus more on procedure of MRI for bone cancer. Before MRI scan session start, patient need to inform doctor or radiographer about any operation that had done previously. This is to notify the parties concerned about any metal implants in their body. Plus, they need to tell the department staff beforehand if she thinks she is in pregnant condition, due to avoid any unnecessary happen after the scan session finish. During MRI scan session, patient need to remove any jewelry or metal they have on their clothes, and they need to change into a hospital gown, while the radiographer will check about medical condition or allergy before asking the patient to swallow or injecting dye into their vein. This dye is to enhance and improve quality image of MRI. This session usually can take up between 15 to 90 minutes depending on the area that needs to scan. And once in the correct position, the radiographer will leave the room and communicate with the patient through the intercom in the control room. Sometimes the radiographer will ask patient to hold their breath. MRI examination were performed by using different MRI systems with adjustment of the coil, field of view, and matrix depending on tumor size, location, and depth. The range of repetition is usually 500 to 700 milliseconds, while the echo time were 10 to 15 milliseconds. Section thickness they put in the range from 3 mm to 5 mm. After the MRI scan session, the radiographer will observe either patient experience any side effect, and patient need to wait result within the time given. Thank you. I will pass to my partner Akmal.
Thank you, my partner. My name is Nur Akmalia. I will give summary about method for bone cancer, and we focus to 3 devices, and our main is MRI. So, X-ray, MRI, and CT scan have been discovered is the best way to diagnose bone and soft tissue tumor. First of all, image segmentation technique can be applied to X-ray and MRI image to recognize an unwanted growth of bone which may be not cancer or cancer. And image segmentation technique have been divided by 2 main layers, which is layer-based segmentation and block-based segmentation, and this technique given to upper hand to bone X-ray other than MRI image. And second technique is tumor staging. This technique have been used because of the advance in computer software that give a better image spatial resolution and faster acquisition time that improve the capability of MRI and precisely define the anatomical extent of a tumor and also give a more accurate stage of bone tumor pre-operative. And lastly is whole body scan. Before any change in internal bone structure that can be detected using CT scan, MRI can detect metastasis in the bone marrow space using this whole body scan technique. And other advantage using MRI is there are no ionizing radiation other than X-ray and CT scan. Okay, next, despite all of the development in MRI technology, T1WSE or fast SE image are still the most reliable sequence for imaging bone marrow and are the most effective technique to detect skip lesion and epiphysis involvement. And the best method for local staging of bone cancer is magnetic resonance imaging (MRI). That's all for me. Thank you.
Thank you. I'm Hema and I'm going to continue on patients' conditions and restriction. First and foremost, pregnant patients. Pregnant patients are not allowed for MRI scan due to the contrast agents like gadolinium could cross the placenta and might harm the baby. Furthermore, radiation exposure of MRI is high and it might not be suitable for the fetus as well. Next patient condition will be breastfeeding women. Breastfeeding women are allowed for MRI scan. However, it's recommended to avoid breastfeeding 24 hours after MRI scan because the contrast agent will be excreted into the breast milk and it can be absorbed by the baby too. So it's safer to pump and dump their breast milk before having MRI scan. Next patient condition will be claustrophobic patients. Claustrophobic patients are allowed for MRI scan. Normally, claustrophobic patients can tolerate MRI examinations. However, if they feel uncomfortable, they could bring their family or close friends together. This might help them to relieve their anxiety. Furthermore, they can also practice slow deep breaths to overcome their stress. Apart from that, they can also visualize or pretend sleeping to divert their mind. Next patient condition will be patients who have metallic foreign body like metasilva in their eyes or aneurysm clip in their brain. These kind of patients are not allowed for the MRI scan because MRI uses magnetic field to generate diagnostic image. So it might affect the image and also might harm the patient as well. Next patient condition will be patients with pacemaker and cochlear implant. These kind of patients also not allowed for the MRI scan because MRI scan might affect the function of the pacemaker and also it can risk the patient as well. Last but not least, patients with kidney problems are allowed for the MRI scan, but it's better to have kidney function screening before having the MRI scan. Common safety and precautions. Remove metal objects like jewelry, watch or any objects that are made up of metal because MRI uses magnetic field. Then hearing protections. MRI makes louder noise, so it's better to wear earplugs or earmuffs. Then wear proper clothes because some clothes are made up of metallic microfibers, so it's better to wear the clothes are given to you during MRI examination because it's safe and comfortable. Due to radiation, limit your bathroom trips. Then always listen to preparation instruction. Lastly, tell the technician about any pre-existing conditions like if you have claustrophobic or kidney problem or any implantation. Okay, next is related articles. The articles that are related to the patient conditions that I mentioned just now is gadolinium containing contrast agent may increase the risk of rare but serious disease called nephrogenic systemic fibrosis in patients with severe kidney failure. That's why it's very important to do kidney function screening beforehand of MRI examination. And then there is no special type of care required after an MRI scan of the bones. So you may resume your usual diet and activities unless your physician advises you differently. Okay, next I pass it to my friend.
Assalamualaikum and hi, my name is Nur Hayati. Now I will be presenting the drawbacks and improvements of MRI. One of the drawbacks of MRI is the extended scan time required to localize the MRI signal in case space and reconstruct an MRI image. Because of the long acquisition period, the image is prone to motion artifacts, lowering the image quality. To improve this drawback, the parallel image technique is implemented. This method is based on the fact that the amount of phase encoding lines in case space has a direct relationship with acquisition time. So if the number of phase encoding lines could be reduced, the MRI scan duration may be reduced. Second drawback is acoustic noise is created during the functioning of the MRI scanner. The gradient coil is the major source of noise, which is caused by rapid current changes inside the coils. This loudness may induce basic discomfort temporary hearing loss, and even permanent hearing damage. So by maximizing gradient activity or minimizing acoustic resonance frequencies, acoustic noise is decreased. Gradient activity was optimized by carefully altering gradient forms as well, such as sinusoidal shape to reduce high acoustic frequencies and lowering the applied gradient intensity. Lastly, the presence of artifacts which can mask pathologic findings and impair the reader's confidence limits the use of MRI's imaging in patients with metallic implants. Due to their magnetic susceptibility, metallic objects produce artifacts by exerting their own magnetic field, which distort the external magnetic field. A recent metal artifact reduction approach for correcting metal induced through plane distortion is CIMAC technique. The intravoxel defacing is reduced using fast spin echo imaging, and in the plane distortion is corrected using view angle tilting technique. So next is the conclusion. The role of MRI in the local staging of bone cancer is well established. All procedures must be carried out carefully to ensure the scanning purpose can be accomplished. So that's all from us. Thank you.